How is AITL different from other T-cell lymphomas? Imagine a type of lymphoma that has a very specific origin and a unique way of behaving in the body. That's what makes angioimmunoblastic T-cell lymphoma, or AITL, stand out among other T-cell lymphomas. And like many other lymphomas that come from different T-cell types, AITL arises from a special subset called T-follicular helper cells. These cells normally help B cells mature in lymph nodes, but in AITL they become cancerous. They express specific markers like CD10, BCL6, PED1, ICOS, SOXA-FUV, and SOXA-ULTHUDN, which are clues used by doctors to identify this disease. This T-follicular helper origin is a key feature that sets AITL apart from other T-cell lymphomas, which may come from different T-cell groups. When it comes to symptoms, AITL usually affects older adults, with most cases around age 65. It tends to be aggressive and causes widespread lymph node swelling, known as lymphadenopathy. Patients often experience enlarged liver and spleen, along with systemic symptoms like high fever, night sweats, and fatigue. Interestingly, autoimmune issues are common too, such as autoimmune hemolytic anemia or immune thrombocytopenia, which are less typical in other T-cell lymphomas. These autoimmune features are part of what makes AITL's clinical picture distinctive. Looking at the tissue under a microscope, AITL has a very characteristic appearance. It shows a mix of different cell types, including the cancerous T-follicular helper cells, reactive B cells, plasma cells, and follicular dendritic cells. There's also a lot of new blood vessel formation, called proliferation of high endothelial venules, which is unusual. The presence of Epstein-Barr virus-infected B cells is common too. This complex and rich microenvironment is quite different from other T-cell lymphomas, which often have a more uniform population of malignant T cells without such a diverse background. Genetically, AITL has some unique mutations. It often carries mutations in genes like TET2, DNMT3A, ROA, and IDH2. These genetic changes are involved in the disease's development and are less common in other types of T-cell lymphomas. This genetic profile helps doctors distinguish AITL from other lymphomas and understand its biology better. In terms of how it behaves, AITL can be tricky. Although it is classified as a low-grade lymphoma because it grows slowly, it often acts aggressively. Patients may respond poorly to treatment, and the outlook is generally less favorable compared to some other T-cell lymphomas. Despite advances in therapy, the prognosis remains challenging, making early diagnosis and tailored treatment very important. In summary, AITL is different from other T-cell lymphomas because it originates specifically from T-follicular helper cells, has a unique set of markers, a complex tissue environment, distinct genetic mutations, and a clinical course that combines features of both slow growth and aggressive behavior. These differences are crucial for diagnosis and treatment planning. If you or someone you know is dealing with this condition, it's always best to consult a healthcare professional who can provide personalized advice based on the latest medical guidelines.